Good afternoon. I'm here with an important announcement of support for Alberta farmers and agriculture as they cope with the COVID-19 pandemic and the associated economic crisis. I'm here with Minister of Agriculture, Deena Hinshaw, and of course, Chief Medical Officer for Health, Dr. Deena Hinshaw, who will follow this important economic announcement with today's daily COVID-19 update. We know that farmers have been seriously affected by the global economic crisis, and more particularly, the livestock industry, both here in Alberta and across Canada, have been affected by the impaired operations of many meatpacking and food processing plants across the country. This has resulted in a significant backup particularly of cattle, but also other livestock here and across the country, which is jeopardizing the industry, and critical action must be taken to ensure a future for our food producers in this country, who too often we take for granted. One thing I think we're all learning through this pandemic is to appreciate a lot of things that we take for granted in our daily lives, including food security, and we wouldn't have that. We wouldn't have full grocery stores. We wouldn't be able to maintain the food security that we have were it not for the enormous work of our agri-food producers, our farmers and ranchers. 40% of Canada's total beef herd and 70% of fed cattle production is in Alberta, and that's 1.6 million head per year. The Canadian beef industry cash receipts represent nearly $10 billion a year. 16% of the total agriculture industry across Canada, generating an estimated 230,000 jobs. So it is vitally important to both the Alberta and Canadian economies to protect this industry from the impact of the crisis, and that's why I am pleased today to announce that Alberta is launching our Fed Cattle Set-Aside program as one of a number of measures to help farmers and ranchers. It will allow producers to hold on to cattle on a maintenance feed ratio for up to 9 weeks, ultimately allowing the supply of cattle more evenly to match demand and reduced processing capacity. Producers will be compensated for extraordinary costs related to feeding market-ready cattle being held back right now. 400,000 cattle are currently backed up in feedlots, creating a potential crisis, as I said, for farmers and ranchers. The set-aside program is a per-head payment to the holder of the cattle until the inventory is cleared. An estimated time frame is 30 weeks. Alberta will contribute up to $17 million through the Agri Recovery Program, which is a joint venture between the federal government and the provinces. An automatic 60-40 funding split is enacted when a disaster hits in the agriculture sector. And Minister Dreesham will share that Alberta is offering to help administer this program for our western neighbours in Saskatchewan and Manitoba in particular. The specific amount needs to be negotiated with the federal government, but we estimate that the total cost of this set-aside program will be in the range of $42 million. We're hoping to restore production capacity as of course, soon as it's safe to do so. The plants working with Alberta Health Services have implemented dozens of new screening and containment procedures and protocols, and a lot has been learned about the terribly unfortunate outbreaks here in Alberta, but also in plants, both poultry and pork plants in other provinces across the country. Federal support for the agriculture sector announced this week included money for personal protective equipment in processing plants that's already being provided by the companies, but this will assist to ensure the safe operation of those plants. And I'm pleased to report that at the Cargill facility in High River, that of the 944 individuals who had been detected with COVID-19, that 826 have now recovered, and of the 583 cases at JBS in Brooks, that 466 of those Albertans have recovered. So we're at about 85% recovery rate to date. And at Harmony Beef in Red Deer, of the 38 cases, 15 were workers have now recovered. Those cases were detected later than in the other two larger plants, but thankfully there's not been a significant growth in cases, even though there's been very intensive and widespread testing. And of course, Alberta Health Services, together with Occupational Health and Safety and the Canadian Food Inspection Agency and Alberta Agriculture, are all providing enormous assistance and oversight to ensure the safe operation of plants. We will also, as a government, be participating in the Agri Stability Program for potato growers. You may have heard there's been a huge backup of potato crops from last year because the suspension of restaurants in particular has meant a huge decline in potato consumption, and this actually jeopardizes this year's crop, because if we don't have a plan to deal with last year's crop, it could create a lot of even soil contamination problems, for example. And so Minister Dreeshen will provide details on how we'll be working with the federal government through an investment to expedite the Agri Stability Program. And we are looking at how we can also participate in the federal buyback program for surplus potatoes, as well as in the pork industry. We'll be participating in a $25 million cost-shared program to address the backup in that industry, which has also been created by a reduction in processing because of the pandemic. And finally, Minister Dreeshen and our government are working with the honeybee industry, which is primarily located in northern Alberta, that has been affected because it's been unable to bring hives in from overseas, and there are some challenges there, as well as the horse racing industry, which is a very important part of Alberta agriculture. Many people are employed in that industry, particularly throughout the horse industry in Alberta, and we are looking at what we can do to be helpful. And so the core message here is that the government of Alberta is standing with our agriculture workers, our farmers and ranchers who do so much for us. That is one of the many sectors of our economy that has been deeply affected by the broader economic crisis created by COVID-19. And so we are pleased to be able to take these measures as we continue to monitor the impact more broadly in agriculture to see if additional action is necessary. And with that, I'll invite Minister Dreeshen to offer some supplementary comments.
Well, thank you very much, Premier. And just to go into more details on the cattle set-aside program for fed cattle here in the province of Alberta, something that we're earmarking of over $17 million, as the Premier pointed out. We're hopeful that this will be resumed as quickly as possible and won't drag out into many, many months. But for right now, it's a $26 million federal cost share part of that program, and $17 million coming from the government of Alberta. So it's our intention that if there aren't any additional disruptions in our beef processing facilities, that the backlog of some hundreds of thousands of cattle that are backlogging up right now and that are reducing cattle prices, and at sometimes having no prices available across the province, we are hoping that that this set-aside program will help to smooth out those wild price fluctuations within the cattle industry. And as the Premier also mentioned, we are in talks with Saskatchewan and Manitoba to be able to administer this program for them as well. Obviously, the majority of the cattle industry in Canada is here in Alberta. So we have the economies of scale, we have the expertise to be able to administer this program, and we are happy to do that with our provincial colleagues across the country, and also to continue to work with the federal government as well on developing the specific details of the cattle set-aside program, and on that even of the weighing in and weighing out of cattle when they go through feedlots. And then on the two agri stability changes that we're making when it comes to the hog industry and the potato industry, $25 million is estimated to be expedited in agri stability advance payments. So right now it's typically about 50% of an advance on agri stability payments are available to these industries. fisheries through agri-stability. And on the hog side, that works out to about $20 per head, about $25 million. And on the potato side as well, as the Premier mentioned, the $50 million bulk purchase announcement by the federal government earlier this year, we're working with the federal government and the potato growers of Alberta to make sure that we can figure out Alberta's share of that $50 million to, again, help producers that have full potato barns of potatoes that obviously are perishable, and something will need to be done with them due to the fact that McCain's near Lethbridge has been shut down for some time. And in addition to on the beekeeping industry, we are looking at a 30% support for hives from neighboring provinces in Saskatchewan and in BC to be able to help the beekeepers here in the province of Alberta be able to build up their hives. Especially in northern Alberta, there was severe overwintering losses. And in addition to that, we're also looking at bringing in bees from around the world as well, also mainland U.S., to be able to build up our hives. That right now it's about 50,000 hives short here in the province of Alberta, but we do think just across Canada we can do about half of that. And then also when it comes to the horse racing industry, we are continuing to develop programs and support for that industry that again are going to have animal welfare issues of, depending on how long COVID restrictions are, that they won't be able to race and to be able to do what that industry does so well here in the province of Alberta. So with that, happy to take any questions, but nope, we'll go over straight to Dr. Deena Hinshaw, and thank you very much.
Thank you, Minister, and I think we'll all take questions shortly, but I did want to just give a few remarks today. I'd like to report an additional 54 new cases of COVID-19 in Alberta over the last 24 hours. This brings the total number of cases to 6,017. Of these, 3,809 have now recovered. Sadly, I must also report an additional 2 deaths, bringing the total number of deaths in the province to 114. As always, I want to extend my condolences to the family and friends of these individuals and all Albertans who have lost loved ones. As of today, there have been 632 cases of COVID-19 in continuing care facilities across the province. With the daily numbers declining lately and discussions about relaunch underway, I know that many faith communities are keenly interested in planning how they can start to safely meet again, and I sympathize with this wish. Our lives have been profoundly disrupted by this virus, and being able to gather with others in a religious community would be a source of comfort for many. I want to share a story with you about why it is so important that we are cautious about restarting practices of gathering in person as a way of preventing future outbreaks. I had the opportunity recently to talk to a faith leader whose faith community gathered together in mid-March, before many of our public health measures were in place. I want to thank this faith community for being willing to share their story so others can learn from their experience. The congregation had a worship service and then gathered together after the service for a celebratory social event. There were only 41 people present, and they were careful to observe 2-meter distancing and good hand hygiene. Food and drink were served by a small number of servers wearing gloves. No one was ill at the time. They followed all the rules and did nothing wrong. Unfortunately, within a week of the event, one person who had been there tested positive for COVID-19. Many others followed. In total, 24 of the 41 people who attended were confirmed to be cases. 3 of those people ended up in hospital, and 2 of them died. It isn't clear what the source of the virus was for the people at the gathering that day. It could have been environmental contamination from others who had previously been in the building. It could have been that someone who attended had been exposed elsewhere, was unknowingly infected and able to pass the virus on to others before their symptoms started. We may never know exactly what happened, but the message is clear. Even with the precautions they took, more than half of those who attended that day got sick. 2 lives were lost, and those left behind are grieving their absence and the incomprehension of how what should have been a joyful event turned tragic. I share this story as a cautionary tale and an example of how informal gatherings, even when trying to follow distancing rules, can result in large spreading events. We all want to be able to gather again. We humans are hardwired for connection, and physical closeness is not fully replaced by virtual gatherings. Whether a religious gathering or social gathering, I know we are all missing being together in ways that we once took for granted. Despite this, I am asking you to remain cautious. I am asking you to keep being creative about other ways of connecting and sharing meaningful moments. Gatherings of no more than 15 are allowed, but as you plan ways of connecting, please consider all your options and make sure that any gathering that happens in person is well planned and ensures physical distancing, no sharing of food or drink, and make sure that you're thinking about ways for those who are at higher risk of severe outcomes from COVID to participate remotely. I acknowledge that the absence of information can make us feel scared or anxious. Another example of this is I've heard concerns from hairstylists and barbers who are wondering why their personal services are being opened up for stage 1 rather than later when they don't have a professional association to provide guidance. In preparation for the staging of Alberta's relaunch strategy, public health officials have considered a measured approach to opening up sectors, including personal services. In this sector alone, there are over 80 unique types of personal services in Alberta, from hairstyling and nail services to tattooing and laser hair removal. Some of these services carry more risk than others. When considering that hair salons and barbershops could open as a part of stage 1, a key point that factored into public health advice was that these professions have provincially regulated training and certification standards. This certification includes a provincially recognized public health component on infection prevention and control. This means that hairstylists and barbers already have some familiarity with protocols aimed at limiting customers' risk of exposure to infections. But I've also heard that there is anxiety within this industry related to things like physical distancing, personal protective equipment including masks, and whether blow drying is safe or can multiple stylists work with one client. Our website includes general workplace guidance for Alberta's relaunch that provides foundational expectation for minimizing COVID-19 transmission risks in all workplaces. However, we are continuing to work on additional risk mitigation information for barbers and hairstylists in preparation for stage 1 of relaunch. This approach, opening only barbers and hairstylists of the personal services at the first stage, mirrors relaunch strategies in other jurisdictions across Canada and in Europe. I would also like to remind these businesses that there is no obligation for a business to open when stage 1 begins. Businesses that feel they need more time to ensure the safety of their patrons or their staff should take the time they need to be prepared and have additional health and safety protocols in place for cleaning and physical distancing. For any business wanting to resume operations, no matter the stage of relaunch, I encourage you to consider what additional information, support, and training your workers may need in infection prevention and control. Finally, with respect to hairstylists and barbers, we are working on guidance specific to this sector, and we anticipate it will be completed soon. We are holding many things in tension right now. The need to protect ourselves and others from COVID-19, our need for human community, and our need to mitigate the social, economic, and health impacts of a prolonged shutdown. In these next months, we need to strive for balance between these things. There is no one perfect way forward, but whatever comes, I know 2 things. One is that we need each other to get through this, and the second is we will get through this. Thank you, and we'll be happy to take questions.
Okay, for the benefit of those on the phone, we also have Dr. Mark Jaffe from Alberta Health Services in the room to answer questions. Operator, can you please put through the first caller?
Yes, thank you. The first question is from Rick Bell. Please go ahead.
Good afternoon. I have a question for Premier Kenney. I know you addressed it partially in the House, but I'm going to ask it perhaps in a different way. Concerning the anti-oil comments of yesterday, what would you say to Mr. Blanchette if you actually were talking to him directly about his comments he made about the oil industry? And sort of part B, what say you of Elizabeth May, who started the story at the beginning of yesterday by saying oil was dead? And how do you personally feel about the kinds of comments you heard in the last 24 hours?
I just think it's deeply regrettable that we would see national political leaders piling on Albertans and energy workers at a time of great trial for us. This is the opposite of leadership. Leaders should be seeking to bring us together, not to divide us. The Canadian energy industry has done more than any in modern Canadian history to create jobs and prosperity, to fund social programs and government services, and to unite Canadians with our equalization payments and transfers across the country, to which Alberta has contributed over $600 billion in recent decades, thanks largely to our energy resources. So here we are because of the global coronavirus recession, a crash in demand, because of the predatory actions of dictatorships who have been trying to drive North American energy out of business so they don't have to compete with democratic oil. They want to dominate the world with dictator oil. Because of their irresponsibility, we've seen the lowest prices in history, which has even worsened an already terrible economic crisis in this province and therefore in this country. And so I would say to Mr. Blanchet and Madam May, please stop kicking us while we're down. We Albertans have been generous, and we will continue to be generous. But these attacks on our natural resource industries are unwarranted. They are divisive. They're, I believe, in a way, un-Canadian at a time like this. It's like blaming the victim. You know, those who say, these two leaders who say that the energy industry is dead, well, I would remind Mr. Blanchet that in Quebec, they consume 60,000 barrels of oil a day, and in recent years, they've had record sales of SUVs, of heavier cars. Quebecers love taking airplanes to vacations and points south. They enjoy the benefits of living in a modern industrial economy, which is predicated on access to affordable energy, much of which, half of which for Quebec, comes from Alberta. And if it didn't come from here, it would be coming instead from the United States and from OPEC dictatorships. Mr. Blanchet said that Albertans have been sending, quotes, a string of insults to Quebec. Nothing could be further from the truth. What we have sent instead is tens of billions of dollars of wealth generated by the hard work of Albertans, including tens of thousands of Quebecers who moved to this province to participate in our energy industry. Quebec receives $13 billion a year in equalization payments to pay for its health care right now during the pandemic. Most of that wealth comes from this province and the people who pay their federal taxes, for example, in the energy industry. So no, we don't send a, quote, string of insults to Quebecers. We send billions of dollars. We send solidarity. We send friendship. We send our sense of shared values and shared interests. Yes, and we also send energy that fuels the Quebec economy. And most recently, we also sent millions of masks and gloves and even 25 ventilators to help our fellow Canadians get through this. I'd like to briefly say this in French for francophone media, pour dire que la responsabilité des leaders dans un moment d'une crise est d'unifier les Canadiens, pas à diviser les Canadiens par région ou l'industrie. Les Québécois profitent énormément de richesse des ressources de l'Alberta. Le Québec reçoit 13 milliards de dollars chaque année des paiements de péréquation. La majorité de cet argent viennent des contribuables albertains, en particulier de l'industrie de l'énergie. Les Québécois consomment 60 000 barils de pétrole par jour. Ils sont les acheteurs des camions. Et sans le pétrole albertain, le soi-disant pétrole sale de cette province que M. Blanchette insulte quotidiennement, sans ça, là, l'économie québécoise ne pourra pas fonctionner. M. Blanchette a dit que les Albertains envoient les insultes vers les Québécois. C'est totalement faux. Au contraire, les Albertains envoient vers les Québécois milliards de dollars en paiement de péréquation. Et nous sommes fiers de partager les richesses de nos ressources. Nous voulons continuer de le faire. Il a dit que c'est la fin de l'industrie pétrolière. Mais, en fait, l'Agence internationale de l'énergie prévoit que la consommation de l'énergie de pétrole d'ici 2040 augmentera. Et même les plus basses prévisions pour la consommation de pétrole d'ici 2040 sera une diminution de seulement 30%. Dans ce monde à l'avenir, il faut que les Canadiens, y compris les Québécois, obtiennent l'énergie de quelque part. Je sais que les Québécois auraient préféré d'obtenir cette énergie-là du Canada et pas des dictateurs de l'OPEC. Et enfin, non, nous ne voyons pas. Nous n'envoyons pas les insultes vers les Québécois. Nous envoyons l'énergie, nous envoyons l'argent et dernièrement, nous avons envoyé les millions de masques, des gants et même des ventilateurs comme une épreuve de bonne foi et de générosité des Albertains.
Operator, can you please put through the next caller?
Yes, thank you. James Keller, Globe and Mail. Please go ahead.
Hi there. This is a question about this is for Dr. Hinshaw, and I suppose if the Premier wants to weigh in as well, about the outbreak at the Curl oil sands camp. In light of everything that happened at Cargill, how are you making sure that Imperial and camp operators are actually following the safety precautions, given the remote setting? And how concerned are you about another large-scale Cargill-type outbreak, given that these workers also live and travel in such close quarters? And if you could just update us on the numbers as well at the same time, that would be great.
Sure. So with respect to Curl Lake, our current total that includes both the confirmed and probable cases is 99, and that includes 78 that are located in Alberta, as well as 21 out of province. And what I would say about that is that we have implemented lessons learned from Cargill, such as rapid testing of all those who are part of a particular outbreak group. And we did identify cases who were either asymptomatic or perhaps had mild symptoms but were identified through that rapid testing and easy access. And what that did was it enabled us to make sure we were doing robust contact tracing and making sure that anyone who was potentially at risk of exposure was able to be identified and then kept away from others. So Alberta Health Services Frontline Public Health has been working very closely with all the companies on the site. Imperial Oil is one of those companies, but there are others. There are other contractors and other companies. And so Alberta Health Services has been working with all those who do have workers there, making sure that there are precautions that are being implemented. That happened very quickly as soon as the first few cases were identified to us. And the things that are being put in place have, again, limited the spread. So the numbers that we've identified, the majority of those cases were identified about a week ago, 5 days ago. We started to see a slowdown. And so the idea being that once you have a transmission event or if there's an exposure, it does take up to 2 weeks after an exposure before all of the cases that are going to result from that exposure to show up. So even if you put in measures immediately when an outbreak is identified, you likely will continue to see several cases over the ensuing weeks. So again, Alberta Health Services has worked closely with all of those at the site. They have been helping make sure that the company knows what needs to be done. And we've also taken lessons learned from that particular site and are making sure that all of the work sites across northern Alberta have the benefit of that information to prepare in case of having cases on their sites as well. So Alberta Health Services is making sure to plan site inspections, site visits on all of those work camps to go over work camp specific guidance, both in preparation for, as well as making sure they're aware of the steps to take should they have an outbreak there as well.
And I'll just add that I spoke for about 40 minutes earlier today to Brad Corson, the CEO of Imperial Oil, primarily about the Curl outbreak, and he commended Alberta Health Services and other agencies of the provincial government for the quick response and the tremendous support and information that Imperial has received. And I, in turn, commended Imperial for going above and beyond our requirements to ensure the protection of the workers, to limit the spread, the quarantine and isolation of those who've been infected, as well as the stepped-up hygiene measures. And so he reinforced that Imperial's top priority is the protection of its workers. And I'm glad to see that the incidence of detected infection seems to have stabilized. And as Dr. Hinshaw just said, we will certainly learn from this as we continue to work with other major employers at work camps to do everything we can to prevent a potential future outbreak.
Operator, can you please put through the next caller?
Thank you. Don Braid, Calgary Herald. Please go ahead.
Premier, Quebec, we'll speak about them for a minute again. Quebec has done a kind of different treatment of the city of Montreal by opening some services outside of the city but keeping them closed in Montreal, because Montreal is a much bigger focus of COVID. In this province, of course, we have the city of Calgary with many, many more cases than anybody else, certainly many more than Edmonton, which has been lightly touched. I wonder if, given that it's been mentioned for the last couple of days that there might be some regional phase out, or phase in rather, of opening measures, if you're actually considering a different status for communities, perhaps different timing for communities, whether large or small. There could be a case like Brooks, for instance, or something like that. But I'm just asking if you intend to do that, and if you do, might there be different timing for Calgary than Edmonton?
Well, as we said in releasing the relaunch strategy a week ago today, Don, we will be looking at local circumstances, probably more so than entire regional circumstances. The health regions, the zones, I should say, are really established for administrative purposes and are not necessarily the best kind of geographic marker of where outbreaks are. So, for example, as I cited last week, northwestern Alberta, the Peace River country, has seen very few confirmed infections, but one small town, I think a village, McLennan, has seen a significant portion of their population testing positive because of an outbreak at one particular senior's home. Similarly, we obviously are very concerned about the outbreaks in Brooks and High River. And so, yes, we will be taking looking through a local lens at how quickly we reopen aspects of the economy to ensure that we're doing it very prudently. I just spoke last night for about 45 minutes to Brooks Mayor Barry Morishita about exactly this issue. Next Monday night, the Emergency Management Committee of Cabinet will be making decisions about the precise timelines for relaunch, including looking at local data. And so we'll be receiving information from Dr. Hinshaw and her team and making a final decision about how quickly we proceed to phase one. So I'm not going to prejudge that decision at this point, I guess I would say it's obviously unlikely that we would move forward at the same level, the same speed in places like High Level and Brooks as most of the province. And so we'll leave it at that, and we'll have an announcement to make, I believe, next Tuesday.
Operator, can you please put through the next caller?
Thank you. Michael King, Global News.
Hi there. For Dr. Hinshaw, the tracing app's been out for about a week now. How many potential cases have been identified thanks to the app? And then part two, what is Alberta's contract tracing capacity, and how is the need for contact tracing going to change throughout the relaunch?
So I don't have information about whether or not there have been cases since the app was launched where the app was used to do contact tracing. So I can ask AHS that, and we'll get back to you. The purpose of the app is, as I think has been as I've mentioned, is to make sure that people who are out and about in the public, if they have the app on their phone and someone else they're close to also has the app on their phone, it allows those phones to exchange a unique and non-identifiable number that then gets activated if one of those people ends up having COVID-19. So that particular functionality then of one person getting COVID and then the contact tracers using that information, we expect that will take a little while until that kicks in, given that we have, I think our current download is 140,000 right now. So we are encouraging Albertans to download it. We know that the more people who have the app, the more functional it will be and the more it will help our contact tracers. So again, we'll get back to you about whether or not AHS has had cases where that case did have the app on their phone. With respect to the number of contact tracers we have, while I don't have the exact number, I can tell you that Alberta Health Services is working to make sure that training is happening to groups of healthcare workers who historically may not have been involved in contact tracing, but who are involved in other parts of healthcare, to supplement our teams of public health nurses and environmental public health officers, who are typically our teams of contact tracers. And we are planning to make sure that we have robust contact tracing capacity and are able to supplement teams across the province so that when there is an outbreak or potentially an increase in the number of cases, that we're able to maintain our capacity and ease the load on some of those who have been working so hard over the last several months, making sure that cases get followed up in a timely way and contacts get phone calls. So that is absolutely a part of the work that's underway, is training up these groups, and we can check with AHS to get the precise numbers for you.
Operator, can you please put through the next caller?
Alicia Corbella, Calgary Herald. Please go ahead.
Okay, actually my question just got answered, but maybe I'll ask a different one. Premier Kenney, there are a group of rural doctors who've come out today, and they're very upset and angry with the Minister of Health and your government with regard to how they've been treated. And in light of the fact, it looks like the trust with the health minister has really broken down. Do you see that there's a need for Minister Shandro to be moved into a different portfolio or moved on?
Absolutely not. Minister Shandro has my full confidence in that of this government. I think he's been doing an extraordinary job under the most trying circumstances probably for any health minister in modern Alberta history. With respect to those doctors being upset, are they upset that the government just provided an additional $83 million in funding for rural physicians last week? We have about 800 rural physicians, I understand. So, Alicia, that averages out to about $100,000 per rural physician. We already have, even before that, the best compensated physicians in Canada. According to the Ernst & Young report, and according to Dr. Janice McKinnon's panel, our physicians on average receive about 25% more in terms of their gross billings than in the other major Canadian provinces. For example, about $400,000 in billings on average in Alberta versus $300,000 in Ontario, even though those physicians pay much lower taxes in Alberta and enjoy a lower cost of living. And and that's okay. We, as I say all the time, we value enormously the work of our physicians, and particularly understand the importance of the services provided by rural physicians. And we think they should be compensated not only fairly but generously. But Lisa, we cannot continue, particularly with the great fiscal reckoning that Alberta will face following the pandemic. We cannot continue to see annual increases for physician compensation that are typically 3 to 4 times higher than inflation. Over the past 5 years, the average Alberta family has seen, in the private sector, has seen their incomes decline after tax by about 10%. Over the same 4 to 5 year period, physician compensation went from about $4.5 to $5.5 billion. So we saw an enormous increase in compensation for one segment of the population that represents, by the way, 10% of the total expenditures of the Alberta government. And indeed, we've seen a 298% increase in physician compensation between over the last 18 years. That's very significant increases. And Lisa, our economy is smaller today than it was 5 years ago. Incomes are down across the board. We're headed into an economic crisis. We are headed into a fiscal disaster where the province's deficit this year will likely go from $6 to $20 billion, and it may even go higher. And so I think it's not unreasonable for us to say that we need greater ability to control future increases in what represents 10% of the expenditures of the Alberta government. We listened very carefully to rural physicians and to our rural MLAs about the unique challenges of attracting and retaining rural physicians, about how their billing practices are in many ways more complex than in urban settings. And we responded, as I say, with a package which represents a value of about $100,000 per rural physician. So with respect, Lisa, if that's not an expression of good faith, I don't know what is. I just wanted to correct one thing from my previous answer about from Don Braid about reopening. I think at one point I referred to high level when I meant to say high river. My apologies. Everything's good up in high level, but we know that there have been challenges in high river, and we're working with the community on that. And I'm afraid with that, I'm going to have to leave Dr. Hinshaw and Minister Dreeshen for any additional questions, because I am late for the First Minister's meeting conference call with the Prime Minister and the other premiers. So thank you very much.
Okay, we have time for 3 more questions. Operator, can you please put through the next caller?
Yes. Julia Wong, Global News. Please go ahead.
Hi, this question is for Dr. Hinshaw. The province is ramping up to do 16,000 tests a day, and we've heard that more testing is a good thing. However, we continue to range between 2,000 and 5,000, even with an expanded list of symptoms. You said last week there were some issues with the supply chain, and it may be that fewer people are getting sick. So how exactly will the province ramp up the number of tests that are done? What happens if that can't be done? And why are we spending all this money if we aren't even close to reaching that capacity?
So there's a couple of things that are important to remember about the increased testing capacity. One is that the reason why it's important to make sure that we have a robust ability to test larger numbers is we are anticipating that when we do start cautiously opening up into relaunch, as people are interacting more, there are multiple different kinds of viruses that could be passed between people. So we expect that more people will start to have some milder symptoms. I want to remind people that across the province, from all of our testing, we are seeing, in different zones. The most recent numbers that were on our website that I was looking at a couple of days ago indicated that South Zone was at about a 7.5% positivity rate, Calgary at about a 5%, and the rest of the zones were ranging between about 0.6 and 1.6. So what that means is, and at that point in time, the majority of the tests were going from people who were feeling sick. that most people who feel sick don't have COVID. They still need to be tested. I still encourage anyone with mild symptoms. We really need to make sure that we do get that testing to happen so we know what's going on. But we know that with all of the measures we've put in place, there's less transmission of disease. As we start to open back up into relaunch, people will be interacting with each other more. We need to make sure that we have capacity to be testing in those contexts where people are maybe starting to pick up other viruses. So we need to make sure we have that capacity and surge capacity. We also have moved to testing large volumes and outbreaks. So while we have the capacity right now to test about 7,000 a day, and we're anticipating within the coming weeks to be able to move that up to about 9,000, and then, as you mentioned later on, 16,000 as that ultimate goal. That doesn't mean that we need to be testing that volume every single day. It means that we need the ability, if we do have large outbreaks, to be able to respond, quickly test, get those results back rapidly. But there's no need to be testing that volume every single day. What it does for us is it allows us to quickly respond, get test results back promptly to people, take action both for the individual who tests positive and those around them. And so really, again, that expanded capacity is about making sure that we can respond to surges quickly and efficiently. And also, I would note that we know that in the fall, we do expect, as we see every fall, to see influenza come back around again. And when we have both influenza and COVID, some of this enhanced testing capacity can be used not just for COVID, but also for influenza. So I think that it's really important for people to know that the capacity to test on a daily basis is the important part. The actual number of people that we test, that is reflective of who is feeling ill, who are in outbreak settings, those who are close contacts, but it's not reflective of the success or failure of our testing program. The success of our testing program is that we can respond to demand, we can respond to surges, and that's what we're making sure we have put in place.
Operator, can you please put through the next caller?
Thank you. Jeff Slack, 660 News.
Hi there. Just wondering, since we are a week away from the reopening, should people keep doing what they've been doing and staying inside and only leaving for just essential items, or are we in a safe position now that people are encouraged more to go out when shops open on May 14th?
So our messaging really is shifting from the stay home messaging that we'd been focusing on for the past few months to more of a stay safe message. We already know with the weather getting nicer, people have been and should be outside, enjoying the nice weather, enjoying the outdoors. And we're also, again, seeing that people are now able to do activities such as golfing. We've allowed those health practitioners who are able to follow the health workplace guidance that we've put in place to consider how they may reopen. And so really what I guess the message we're sending to people is that there are some additional opportunities for people to get services, some additional opportunities for recreation, and it's okay to go out cautiously. We still would recommend that those who are of an older age, so particularly those over 75 and those who have chronic medical conditions, to remain very cautious and be considering what places they go to. But again, as we're looking towards that reopening, we're really focusing on a stay safe message, because what we need to do as we're thinking about the future and moving forward into what this new normal will look like is taking all of these things that we've learned about physical distancing, making sure that we're washing hands, not touching our face, and most importantly, staying home if you're sick, and carrying those forward into what this new normal will look like in relaunch. And I just want to emphasize that last point. So if you are feeling ill in any way, sore throat, runny nose, fever, achy, cough, you should absolutely not be going out until you're feeling well, and ideally to be going online or calling 811 to arrange for testing so that we can make sure we understand exactly what's happening with COVID across the province.
We have time for one more question. Operator, can you please put through the last caller?
Yes, thank you. Darren Krause, Live Wire.
Hi, thanks very much. Some of the questions on the testing were already asked. I do have a question in regards to what impact that has on the data moving forward that the province is able to collect, especially in terms of the modeling that we're doing moving forward. And I guess as an extension of that, on the modeling, have we considered at all modeling for the general population versus modeling for worksite populations and those sorts of things?
So again, what I would say is that we have broadly expanded our testing eligibility. We have opened up the testing to people who have a broad range of symptoms, so not the core 5 symptoms that we've been focusing on, but as you know, just this week, we've opened it up to additional symptoms, making sure that we're also testing close contacts, testing in outbreaks. So we are testing almost 4,000, running almost 4,000 tests a day right now, and the cumulative total of that, so we've run 174,327 tests at this point, and that does give us very good data. It helps us understand where the virus is, and it helps us, particularly with outbreaks, to get a really good picture of where things are spreading. With respect to modeling, again, I think that the testing data we have is extremely robust and very helpful in our modeling and looking at what may happen in the future. What some of the modeling that the team is looking at, and I haven't seen the end results of this, again, modeling is simply a tool to help us imagine different scenarios. It doesn't predict the future. It's a tool about imagining if this happened, if this assumption were true, how would this unfold? And some of the things that they've been looking at are around, what impact would, for example, opening schools have on our modeling? What impact would easing restrictions in particular sectors have on the modeling numbers? Again, that's not a prediction of the future or a guarantee, but those are some of the things that are being taken into account, but I'm not sure where that modeling's at and what the timeline is, but those are some of the scenarios that are being considered.
Thank you very much. We'll be back tomorrow with another update.